action where medical thread short sutra we are using. Snowy, in this band we already said latex used, chemical irritant, acts as a chemical irritant and smooth cutting. And second one, apomark action as per ash, we ash used, caustic action is there in this ash, and lysis of tissues be done by in the tissues. So the third one, Kharida curcuma roma, the powder we use, antibacterial, antifungal, anti-inflammatory, antioxidant, anti-hepatotoxic and coagulating. So combination of the three plants, the chemical coordination in medical thread known as Shar Sutra, simultaneously cutting and healing. You all know about fistula. What is fistula? I don't want to go further and give the introduction. But just light I want to discuss is an aerotract lined by granulation tissue communicated with the anal canal penincle. It almost always follows bursting and decision of the perineal abscess. It has one or more opening in the perineal skin. So what is the actual treatment of fistula and is the total excision of the tract surgically. So before go for this Sharsu treatment, we always advise to the patient to come through in our center for all investigations like pathological investigations, MRI, fistulography, etc. During the process, we take the tissue and specimen for know the histopathological investigations like biopsy, etc. Now, how we do the process management of anal fistula by combined approach, Sharsu therapy and model. First, I show the photo. That photo is actually we open from the external opening with inside one probe. From that external opening we open up to the sphincters, except up to the sphincters. From there, after that we putting the simple surgical thread. After putting a simple surgical thread, we advise to the patient to come every 10 days to change the thread. That is the change the thread is called Shar Sutra. We applying Shar Sutra in every 10 days. By doing this process, from the last loop of the thread, when cuts automatically itself fell down by Shar Sutra and the whole thread heals automatically. How we do the process, I show the video. First, by anesthesia we doing this process. So first we did the dilatation. Then inserting the external. First we create the external opening of the tract, fistula tract. Then after that we take one probe and insert the probe and curate the tract. After that we inserted the methylene blue, the dye, to know the actual opening of the internal opening of the fistula tract. By using speculum, by using speculum we find out the internal opening of the fistula tract. And also using the forefinger, we find out the internal opening of the fistula tract. So like this way we are doing, and using this probe is inserting the anal fistula of the external part of the external opening of the thread. Then easily we apply the simple thread in the thread. After that, After that, we applying a new Shar Sutra is applying. So every 10 days we give the follow visits to the patients, and every time we changing the simple railroad technique. We use the word railroad technique, means train track technique. We are changing this Shar Sutra. So come to the pain and irritation feeling chemical study of treatment of clinical study of treatment of anal fistula disease. Pain and irritation feeling patient doing treatment by only Shar Sutra and combined approach. What is the shows I showing you? Pain and irritation 70% by Shar Sutra treatment. If you go for only Shar Sutra, pain and irritation feeling patient 70%, and if you go for partial fistectomy and combined approach, pain and irritation is only 30%. And recovery time is same low type anal fistulas and so. Okay, sir.
I think we will have to stop the presentation.
Yes, sir.
And
Sir, this is the photos where we're showing how we've treated. This is photos. We treated.
I think we need to stop the presentation to be fair to other presenters. Any question from the floor?
Sir, I want to give some conclusion to the patient. Yes, sir. If you allow me to give some conclusion. It gives freedom from painful dressings. There is no loss of gluteal muscles and hence the anatomy of the perineum is not distorted. The procedure leaves just a princess cut at the side. The recurrence rate, which is usually found to be quite higher after modern fistula, is less than 1% after combined approach procedure. And clear chances of partial or complete is not is always present in the many types of fistulas, but in this procedure, not seen any type of partial incontinence problem to the patients. So finally, 100% efficacy is seen by doing both approach like partial fistula and applying Ayurvedic shots in the dominant type of fistula analysis. Thank you.
Well, to be fair to the other presenters, I think the last part will not come into your study presentation. How would you follow up the patient? Any patient lost on the follow-up?
No, sir.
Are the patients, all the patients come back for follow-up?
Yes, sir.
Okay. How long do they follow
up? It depends upon the length of the tract. We firstly do the fistulography, MRI or fistulography. After that, we decide what is the length of the tract. Then we give the actual details to the patient.
Follow-up.
Follow-up
they come back
every 10 days, sir.
Every patient?
Every patient in 10 days.
In 10 days?
10 days.
Oh.
They come and they do work, their own work. They go to do job also.
Okay. What is the failure rate?
Yes, sir.
What is the failure rate?
Sir, there is no failure because
no failure.
No failure, sir.
Okay. How many patients?
Sir, these are photos which I shown in this slide. From 12 years I am doing this practice. All the patients are getting very good with good efficacy and good heals.
All healed.
Yes. Sir.
No failure.
No failures.
Okay. Okay, thank you very much.
Thank you, sir.
We'll have the next presentation.